Okay. Right. Okay, should be good to go here. Hopefully y'all can hear me okay. So hi everyone, my name is Dana Wilkos. I'm the health literacy educator for the New Orleans Public Library. I'd like to welcome you all to the final program in our Research Matters series. All of Us, the Future of Health Begins With You. This is in partnership with the LSU New Orleans School of Medicine, as well as the All of Us Research Program. I want to start by thanking you all for joining us today, as well as our partners over at LSU. Please be sure to check out nolalibrary.org for more virtual programming and e-resources. And if you're here in New Orleans, you can find information about how to sign up for our 45-minute in-person library sessions. A couple of quick housekeeping notes before we get started. As I mentioned, we are recording, so please keep that in mind as we move forward. This will be posted on on the New Orleans Public Library YouTube page. I'll put a link in the chat for that. And I apologize for the delay on the link for last week's session. That should be going up next week. So it is coming. And then another thing of note, you'll notice we've muted everyone upon entry. I would ask that you just leave yourselves muted until the end of the program. If you have any questions, feel free to put them in the chat. We can address those at the end. I'd also recommend turning on speaker view in Zoom, as I think you'll find that most helpful throughout the presentation today. This meeting should have some closed captioning available as well, so hopefully that's showing up on everyone's screen. And last but not least, I will be putting a link to a brief survey at the end of this presentation, so I kindly ask you to fill that out. For those of you who have been here the last few sessions, this part will probably sound quite familiar to you, but for those of you who are new or just joining us today, this series is brought to you in part by the network of the National Library of Medicine, which is the core of the National Library of Medicine's Community Engagement Program and has 8 regional libraries and over 7,000 network members. The mission of the network is to advance the progress of medicine and improve public health. And it supports its mission through the regional medical libraries by providing funding, training, and connections to empower members to transform their communities with trusted health information. They aim to improve the public's access to information with the goal of empowering people to make informed decisions about their health. The National Library of Medicine and the National Institutes of Health's All of Us Research Program have teamed up to build the NNLM All of Us Community Engagement Network and an All of Us Training and Education Center. The All of Us Research Program aims to build one of the largest, most diverse data sets of its kind for health research, with 1 million or more volunteers nationwide who will sign up to share their information over time. The Community Engagement Network is part of a pilot project and focuses on NNLM's mission to improve the public's access to information to enable them to make informed decisions about their health by partnering with public libraries across the United States, including the New Orleans Public Library. So in parts 1 and 2 of our series, we discussed health inequities, how medical research can address some of those inequities, and why having a broad range of participants is so important for individuals, their families, and their community. Today, we'll be taking a closer look at the National Institutes of Health's All of Us Research Program and how your participation can change the future of healthcare. Our speaker today is Dr. Ayesha Umrigar, who joined us last week as well. She received her PhD in human genetics from Louisiana State University Health Sciences Center. She also serves as an engagement lead for the All of Us Research Program, discussing the importance of precision medicine to the general public. In addition, she's currently working as a postdoctoral fellow at LSU, where she conducts research in health and science policy. Dr. Umrigar, thank you so much for joining us today.
Thank you, Dana, for the introduction. All right, let me get these slides over here and I'll start sharing. All right. Well, good afternoon, everyone, and thanks for coming to part 3 of our series, Research Matters. Dana, thanks for the introduction. Like she mentioned, I serve as the engagement lead for the All of Us Research Program at the LSU Health Sciences Center site. So there are different sites to this program. Tulane has one, as we had a speaker from Tulane speak at one of our series. So first, to get started, I first want to go over what is precision medicine. I did touch on this during our last talk, but I just wanted to give everyone a reminder. So precision medicine, it's an emerging approach for disease treatment. And what it does is it takes into account a person's lifestyle, biology, and environment. So when we talk about lifestyle and environment, we're talking about things like, well, what's your access to healthcare like? Do you live in a good neighborhood? What's your access to education? Have you had significant exposures to systemic racism? Because all of those things can come together to affect your health. It's not just biology. So that's why research studies going forward are trying to study the whole person instead of just biology. So with that, we then move on to the All of Us research program. So the All of Us research program, this is an NIH program, and the main things that this program is trying to do is change the focus of research towards precision medicine. So the program wants to gather data from 1 million or more people living in the United States, and they want to study socioeconomics, environment, and biology of the study participants. And so this would be taking a step towards having research studies geared towards precision medicine. Now, later in the talk, I'm going to go into a little more detail on, well, why do we need 1 million people? Why do we need to study all these characteristics? I did touch on it a little bit during my last talk, but we're going to go over it a little bit more during this one. So what kind of questions can we answer with the data we get from the All of Us research program and precision medicine? Again, I talked about a little bit about this last time. Well, we talked about how sometimes some medications may not work for different people, like certain medications are not recommended for people of African American ancestry. So this kind of plays into that. So like, how do we develop better pain medicines that aren't addictive for some people? How do we develop sustainable interventions to support health equity? Cancer research, this is a really, really big area for precision medicine. Because the development of chemotherapy drugs or drugs to treat cancer, these were often developed on a trial and error basis, which, I mean, chemotherapy can be very, very painful. So if we can have a process to get it right earlier, that would be a really, really great thing to have. So I mentioned that the All of Us research program is a bit different from some of the research programs in the past. One of the first things is having 1 million or more people enrolled in the program. That is a lot of participants. The last time I talked, I would mention why these studies need so many participants. It's just that, you know, sometimes you need a lot of people to see a certain effect. Like if something only affects 1% of the population, you're going to need a significant amount of study participants to see that effect. Not only is it a 1 million people, we also want 1 million people from a diverse group. So we talk about these populations being underrepresented in biomedical research. I talked about these populations last time, but they would include African Americans, Hispanics, Latinos, Asians, Pacific Islanders, and also women. Another unusual aspect of this program is that the data needs to be collected over a long period of time. So ideally, we would enroll the participants in this program and then follow them over a period of, we're hoping, about 10 years. So the reason we need such a long time frame is to see what sort of changes these people experience over time. And some of the things we would be looking at would be environmental, clinical, behavioral, and so on. Another thing that the All of Us program would like to do is to focus on participants as partners. So a lot of our participants, they're on our advisory boards. We ask them for feedback saying, hey, what can we do better? What are people in your community saying about the program? What can we do to reach them? And we also want to give information back to our participants. And I'll talk about that a little later in the talk, but we do give information back to the people who participate in the All of Us research program. Also, the data is used to create a national open resource for all, so it's open to the public so that researchers and any citizen scientists can look at it. Now, I just want to mention here that there are safeguards in place to protect people's privacy and people's data, and I will be talking about that a little later in this talk. So, what could participants gain from this? Well, there's a long list over here. There's quite a bit going on the slide. But basically, you get a chance to learn about your own health because, like I said, we do give back information to our study participants. A big thing about this program is to ensure that your community is included. My last talk focused on underrepresented groups in biomedical research and why that is such a detriment to biomedical research. Because if the people who are participating in biomedical research, which traditionally have been white men, if you're only studying that group, then most of the treatments are going to be tailored towards that group, which is a problem. You also get a chance to learn about additional research opportunities should you decide to participate. So what would we be asking of people participating in the program? Now, I know it does look like a lot, and I just want to start off by saying that participation in the program, you can do as much or as little as you want. EHR is electronic health records. So basically, when you sign up and you consent, you have the option, you don't have to do this, but it's an option, of sharing your electronic health records with researchers. And so this is just to study how your health is doing. It also involves answering surveys. There are quite a few of them. There are 6 initial surveys. The basics is just things like, demographics. Are you a male or female? How old are you? And also ask questions about your overall health and lifestyle. It asks you, what's your access to healthcare like? Do you have easy access? Also wants to ask about your family medical history and also your personal health. And they do release additional surveys from time to time. Should you choose to do so, you can also come into an All of Us research clinic. We do have physical locations to take your physical measurements. So this is just a list of the things that would be measured during the physical examination. And again, if you want to, you can also provide biospecimens, so saliva and urine. And I'll talk a little bit later about what exactly we do with these biospecimens. Also, if you do have a Fitbit, you have the option of sharing the data from your Fitbit with the program. So why are we just coming out with this now? Well, one of the reasons is that we have the technology that can crunch huge amounts of data. So obviously the program is going to generate an enormous amount of data. And in the past, we really didn't have the computing capacity for all of that data. But now that technology has improved, we can do that. Also, another thing, why now? More people are engaged with their health, and there's so many fitness tracking apps and health apps. And if you want to share that data, that could be helpful for researchers. And the third is we have a greater understanding of human genes. So I'll be talking a little bit more about genetics later in this talk, but basically what that is saying is that we have a better understanding of what gene does exactly what in the human body. So the way this works is that a participant, if you choose to join, you'd share your data. And then we go ahead and protect that data. So I mentioned earlier that this data can be used in an open access repository. However, any personal information that you choose to share with us, your name, your address, or other things that can identify you, those are removed. So no researcher or nobody who's looking through that database can find out who you are. If you decide to give any samples, your name will not be on those samples. And they're stored in, we call them biobanks. So what all a biobank is a place to put all blood and urine samples. So what happens next is the researchers then study the data It says here approved researchers because you can't just, not any old researcher can just go into the data and use it. You do have to sign data use agreements. And then participants, like I mentioned, participants can also get back their information should you choose to do so. And the researchers who have access to the data can then use that data to make discoveries. Okay, I did mention that your data is secured if you choose to share it with us. So the data is stored in a warehouse that is built with the most advanced security that we do have available, and is tested on a regular basis. Like I mentioned before, any direct identifiers, your name, your address, anything that could possibly identify you are removed from the data set. So a researcher would not be seeing those. And also the data is encrypted. I mentioned this earlier, but any researcher who wants to use this data, they have to sign a code of conduct before accessing this data, and you have to get approved before you have any access. I'll talk a little bit more about the certificate of confidentiality later, but that just means if a court tries to tell us to give over your data, we can tell the courts you can't do that, no. And we are committed to transparency in the event of a data breach. We do take every precaution to go and protect your data. However, I mean, we should note that there is no such thing as an unhackable system. So in the event of a data breach, we are committed to notifying everyone. Okay, I do want to talk a little bit about what the All of Us research program is doing as far as coronavirus research. So with the start of the pandemic, there was a new survey that was released called the COVID-19 Participant Experience Survey, or the COPE survey. So this survey, it's really helpful because it helps the researchers learn how the pandemic is affecting people's physical and mental health. So it'll ask you things like, how are you mentally, how are you feeling on a day-to-day basis? Have you had any thoughts about hurting yourself? Have you had decent access to healthcare? Another thing that we're looking at is we're searching for antibodies. So antibodies are used to check for a past infection of coronavirus. If anyone has had the nasal swab, this is not the nasal swab that checks for an active infection. This is a little different. It just checks to see if your blood has antibodies in it to determine if you were infected in the past. So what they're doing is that blood samples from people who had joined recently, we're looking at those to learn more about the origins and spread of COVID-19 within the United States. And also for the participants who chose to share their electronic health record, researchers are studying that to find out why COVID-19 affects people differently. We talked a little bit about this during our first session. I mean, there's such a variation in the symptoms that you'll experience with COVID-19. Some people are completely asymptomatic, they show nothing, and then some people will end up in the hospital severely affected or end up dying. Okay, so I'm going to switch gears a little bit over here. I did mention that I do want to talk about DNA and what are genes. And so when I mentioned earlier that the program, if you choose to do so, you can donate a blood sample to the program. So what we do with the blood sample is we look at DNA. So what exactly is DNA? So it's short for deoxyribonucleic acid, and it's the material that makes up your genes. So this slide refers to genes as recipes. So if you think about it, your DNA can kind of be referred to as the cookbook that contains the recipes, which are your genes. So these genes carry the information for determining traits. So genes will say, hey, we're going to make your eyes blue or your hair curly, or genes can also influence your risk of developing some diseases. They pass from parents to kids. So half of the DNA comes from your biological mom and half came from the biological dad to make you, you. Now, when it comes down to the nitty gritty of it, we're not all that different from each other. 99% of our DNA is the same as everyone else's. There's just a very, very, very tiny amount of DNA that's different from person to person. And that is what makes everybody unique. So how do these genes affect health and disease? So basically, I mentioned that the genes would kind of be the recipes of your body. So the creations from these recipes can be kind of thought of as proteins. So proteins are specific molecules that carry out nearly everything that happens in our body. So then whatever is encoded in these genes to make these proteins, these can affect your health and sometimes cause disease. So you may have heard of things that are called like a breast cancer gene or a baldness genes. I mean, the terms are not quite accurate because it's not really a gene that says, okay, this gene, the exact purpose of this gene is to cause cancer. Especially a good example with cancer genes, like a lot of cancer genes actually do serve a purpose in the body, especially when you have an embryo that's developing in the uterus. A lot of those cancer-causing genes are actually needed during embryonic development to allow for the fetus to grow. The thing is that once the fetus is finished growing, those genes are supposed to be turned off and never turned on again. But things can happen, and that if that gene accidentally gets switched back on again, that can cause cancer. So that's a more accurate description rather than just saying it's a breast cancer gene. And doesn't even just one small change in that gene can have a large effect. Some things are passed down through families. We refer to that as hereditary, but not always. Some of these things can just happen by chance. So why are we asking you to share your DNA? What can we learn from it? Well, if we study it, we can identify what makes people more or less likely to develop a disease. This is also an interesting one, finding out how the environment, lifestyle, and genes can impact health, because your genes don't exist in a bubble. Like what happens to you in your outside environment definitely affects your genes. It's called epigenetics if anybody wants to read more about it. It's a really, really interesting and cool field. We can also identify treatments which work best for different types of people, because believe it or not, sometimes depending on what gene you have depends on how well a drug will work for you, which kind of ties into the next point, creating medications to prevent common conditions such as chronic pain or diabetes, and also for building better tools for detecting conditions. All right. So how will we protect your DNA information? Because obviously your DNA does contain a lot of sensitive information. So we do want to keep this protected. Like I mentioned before, any information, including your DNA, is de-identified. So any researcher who's studying your DNA, they don't know your name, they don't know where you live. They just have your sample and that's about it. We also follow the federal, state, and local law regulations for keeping your information safe. And I did talk a little bit already about the certificates of confidentiality. So like I said, if a US government agency says, hey, you need to turn over that information, we can come back with that certificate and say, no, you cannot have that information. We do have some very strict internal policies and procedures to make sure your data is not misused. Like I mentioned previously, any researcher who wants to study your DNA has to sign off on the agreement, and we have to be approved before we can study this DNA. And if we say break that agreement, we do face some pretty serious consequences for that. Again, any information that you give us is stored on protected computers, which are security tested regularly. And we do inform participants of any breaches that could be a potential risk to privacy. I did mention earlier that we do share information with participants. So this is the information that we get from your DNA that we can share with you. So the first being your ancestry. This is especially these days, this is a very hot topic with all of the 23andMe, Ancestry.com kits that are coming out, which will tell you your ancestry. So this just tells you where in the world did your family come from. It'll also show you what traits you have, why some people might love or hate cilantro. Like personally, I love cilantro. I cannot get enough of it, but I do know some people who insist that it tastes like soap. That is genetic. So there's a gene that, if you have it, can make cilantro taste like soap to you. It can also tell you whether you have an increased risk of developing a particular health condition, how your body might react to certain medications, and other health-related information. Now, if you just want to learn about your ancestry or your traits, but you don't want any information about your health or any potential increased risk of disease, you can do that. So you can just, if you decide to join and you log in, you do the consent and you can just tell them, I just want my ancestry and my traits genetic profile. I don't want anything else. And that is completely fine. So genetics, it's a really fascinating field. So if you do want to learn more about genetics, there are a lot of resources out there, particularly through the NIH and National Networks of Libraries of Medicine. These are just a few resources out there. So feel free, once the link is posted and these links are available, to go ahead and go through these websites, because there's really a lot of good information out there that explains genetics in a really, really good way. And so I just wanted to put this slide up to just show how many, what a diverse network of partners we have. We could not do this program without having all of these diverse partners working with us. All right, so that was short and sweet, and thank you all for listening. If you would like more information on the All of Us research program, the website is over here. You can also find out more about what research we're doing at researchallofus.org. You can find us on Facebook, YouTube, Instagram, and Twitter. On Twitter, it's @AllOfUsResearch, #JoinAllOfUs. And of course, here's the information for allofus.nah.gov. For our LSU site, if you have any questions and want to contact us, you can feel free to email us at joinallofus@lsuhsc.edu or giving us a call at this number shown here. If anybody saw the first session where Dr. Milay spoke, he is on Twitter and LinkedIn, and these are also serve as our All of Us or social media channels. So if you want to get specific information about All of Us from our site, you go ahead and follow Dr. Milay on Twitter or LinkedIn, and we post stuff about All of Us there. Okay, and that was my last slide. So thank you everyone for listening. Are there any questions?
Thank you so much, Ayesha. I do have one question in the chat from Tamara. She asked, how long is the approval process for researchers to be granted access to the database?
That is a very good question. I can definitely go ahead and look that up, and Dana, I can pass that on to you, and we can go ahead and send that into an email to the participants afterward, but I can definitely ask that.
Okay, great. And I had a question that I don't know if you touched, hopefully I didn't miss it, but I was wondering, one of the things as someone who has signed up for All of Us that I really appreciate is having access to all of your health information. Are they able to connect with your providers to kind of get that information, or can you talk a little bit about how that works?
So if somebody's a patient through LSU, then the information goes directly to them. If your provider's through somebody else, I think there are extra steps to it. And again, if you want more information on that, I can go ahead and look that up and get that back to you.
Okay, I was just curious. And I am gonna put the link to the survey in the chat if everyone could just take a minute to fill that out for me. And I'll be sending, as I have in the previous sessions, just a follow-up email. I'm also going to put a link to our YouTube channel, which is where the videos will be posted. so that, like I said, we don't have the last week's up yet, but we will very soon. So last week's and today's will go up hopefully early next week. So just so everyone knows, and I'll be sending again these links around in the follow-up email as well, so that everybody has access to them. Does anyone else have any questions or any thoughts about anything over the last few weeks, if anyone has anything to share? Doesn't seem like it. Okay, well, I think that that does it. I'm also, I know she put all the links for in the slides, but since you can't access those directly, I did want to put just the all of us link in there.
Sure, and I can actually go ahead and pull those links off the slide and send that information to you, Dana, to disseminate to the people who are registered. Okay. So yeah, I'll go back and get the information that you asked and Tamara asked, and also I'll get you those links.
Great.
And feel free to distribute that.
Okay, yeah. All right, well, I think this wraps it up. Thank you so much, Ayesha, for a wonderful presentation. Thank you all for joining us for these last few weeks. Again, if you have time to do the survey, I'd appreciate that. And we'll be in touch. Please feel free to reach out. You have my email address in the registration for this program series. So if you have any follow-up questions or anything for any of our presenters, please feel free to reach out. And otherwise, everyone have a great day. Oh, I do have, okay, that's all. Thank you all so much for coming, and we'll see you soon.
Thank you, everyone.
All right, thank you.